We're going to start with active range of motion of the knee. We're going to ask the patient to keep their heel on the bed and bend their knee. Bring it towards the butt. Okay, and then you want to make sure that the hip is not moving. You put your hand here and you apply over pressure. Any pain? Okay, and you ask for pain as well when they do it. And we're looking for that soft tissue approximation when you're going up because the calf is touching the hamstrings. Okay?
The weight of my leg is preventing from hypertension.
So now for passive range of motion, for passive range of motion, you're going to put your hand underneath the patient.
My muscle bulge.
You're going to keep your hand here on the ankle. And you're going to initiate the bend with your fingers over here. And then you shift your hands up here. And then keep your legs down. And then you overpressure again. Any pain?
No.
And then bring it back down.
So why are we putting a towel?
Okay. So now we're going to do rise arm for knee flexion, but the patient is too far on the bed, so you're going to ask them to come a little bit closer down the bed. I'll move the pillow for you. Come a little bit more down. Okay, that's fine. You want to be able to just have a grip. You don't want to lean too forward. You want to have a just put your hands here. Okay. You're going to bring the leg slightly above the bed, and then you can ask the patient to resist your movement. I'm going to be pushing outwards, and you're going to be trying to flex your knee. Okay. Ready? 3, 2, 1, go. 1, 2, 3, 4, 5. Okay. Any pain with that? And then you're going to ask the patient to resist your movement. So I'm going to push this way, you're going to push that way. Okay, you ready? Go. 1, 2, 3, 4, 5. Okay. So now we're going to do active range of motion and passive range of motion for knee extension. So you want to fold the towel, and then you want to put it underneath the patient's knee. Relax. Okay. And you can ask the patient to try to push their knee against the towel and extend their knee up. Any pain with that? Okay. Relax. And you're going to apply overpressure. Any pain? Okay. So for passive range of motion, it's going to be similar. You're just going to go up here and then up. Any pain? So for knee extension, for rise arm, there's 3 variations you can do. You can do like this, you bring the patient's knee like this, bend your knee on this side, and support yourself with the other knee. And then you ask the patient to don't let me move you. Push, 1, 2, 3, 4, 5. Any pain? No pain. Then you can just put the knee down like this, okay? And then you're gonna again say the same thing, don't let me move you. 1, 2, 4, 5. Any pain with that? Okay. And the other one, you can have them sit at the edge of the okay? And you're gonna go like this. And you don't want to be facing them because if they're stronger than you, they might kick you. So you're gonna go like this, and you're gonna push. 1, 2, 3, 4, 5. Any pain? You can also do knee flexion for rise arm in this position. You tell the patient to bend their knee, and you're gonna be leaning back with your body the other way. Okay? Ready? 1.
Don't remove you.
Keep your hip on the bed. Ready? 1, 2, 3, 4, 5. Any pain? So now we're going to palpate the TFL. You're going to find the ASIS, which is right here, and you're going to go 45 degrees down, right over here, and you're going to ask the patient to immediately rotate their, and you could see my fingers popping in and out.
What else would you do? Stop
it. So we're going to palpate for glute medius, and you're going to find the PSIS, and you're going to place your hand almost near the ASIS, and then your other hand is going to go to the greater trochanter, and you're going to ask the patient to abduct their hip while keeping their feet together. Okay, so that's a good idea. And then you're going to palpate the length of the muscle, and you can feel it stiffening up. That is the glute medius. We already found the TFL before. Now for the IT band, you're going to ask the patient to abduct their leg, keeping their leg straight. Abduct it, bring it up, and then you just follow the IT band down. Put it back down, and then back up, and then you can feel the muscle stiffening up. Lateralis, you put a pillow between the knees and you ask the patient to extend their knee. And then you'll feel it on the outskirts of the iliotibial tract. Now we're going to find the patella. Okay. We're going to ask the patient to relax. If they're not relaxed, you're not going to be able to feel it. So come a bit closer. You're going to move the patella medial and lateral.
Medial tibia.
You're going to move it inferiorly and superiorly as well. Wow, it's really moving. Okay, and then
Right here? Is it as medial tibial plateau?
now we're going to touch the tibial tuberosity, so you're going to ask the patient to bend their knee. Come on this side. And then this is where the tendon of the quads, they go over the patella and they insert on the tibial tuberosity, this bump right here. And then you're checking to see if it's in line with the patella. Patella is here. Tibial tuberosity, yeah, it's more or less in line. Okay. Back with the knee flexed, and you're going to try to find the head of the fibula. So head of the fibula, you know that's where biceps femoris attaches to. Okay, so you can feel the tendon here, and then you follow it, and you can place a finger in the back and in the front, and then you can move it. Any pain with that? Okay. Okay, so now we're going to palpate the tibial plateaus. So you're going to ask the patient to bend their knee. Okay. And then you're going to go down from the patella. You're going to feel a gap, and you're going to be on the tibial plateaus. If you want to palpate the menisci, the medial and lateral menisci, you just have to go more out. Okay.
Yeah, before this.
So we're going to palpate pes anserinus. Pes anserinus is on the medial aspect. On the medial aspect. And what muscles attach? The hamstring muscles, right?
Yeah, semitendon.
Okay, so don't let me move you. One more time. Okay, and you can feel pes anserinus, some of the tendons popping into your finger here. Again? Yeah, right here. Look, right here. Push. So now we're going to palpate the epicondyles of the femur. You can ask the patient to relax because you need to move the patella. Okay. And you can shift the patella, let's say medially, and then palpate right here. Any pain? You can shift the patella laterally, so laterally. Any pain? Okay. I made a mistake. What I just said is wrong. This is the femoral condyles, not the epicondyles. We're going to redo the femoral condyles. For the femoral condyles, we're going to ask the patient to relax. Okay. And you can even use the same hand. You're going to shift the patella medial, and then right on top, you're going to feel the femoral condyle. And then you're going to shift it lateral. With the same finger, you can feel the bone. Okay? So to find the adductor tubercle, it's on the medial side of the leg. You're going to ask the patient to bend their knee. You're going to palpate the tibial plateaus. You're going to feel a space in between, and then you're going to reach the epicondyles of the femur. And then you're going to go on the medial side till you feel it turning, and then you should be on the adductor tubercle. You can even ask the patient to adduct. So bring your leg in, and you resist, and there we go. You should feel the adductor tendon popping into your fingers. Okay, so we're going to palpate the lateral collateral ligament. You're going to ask the patient to bring her ankle over her knees.
Yeah.
Even if it wasn't, they don't fix that.
Like this, and then relax. And then it's going to be right here. It's a roll-like structure. You should feel it right here. Any pain? No. So now we're going to ask the patient to sit down. Can you sit? Okay. And then you're going to palpate along the medial aspect of the femoral epicondyle. Okay? You're going to go here. And then you're going to palpate distally to the tibia going horizontally. So it should be here.
And then the lateral one.
I'll just ask her to. So we're going to palpate the MCL now. Ask the patient to bend the knee. And then, since you're very smart, you know where the tibial tuberosity is. You're going to go a little bit up till you feel that joint space. And then from the joint space, you're gonna palpate along the medial meniscus. And then this is gonna be the medial collateral ligament because it's connected to the medial meniscus.
Yeah.
And you're gonna palpate horizontally. So now we're gonna do the ankle, and we're doing observation first. So you're looking to see, first standing, you're looking to see the arches. If there's an arch on either side, there's not much of an arch here, okay? You're looking to see any weaknesses. You're also looking to see if for toe bunions, which there isn't. You're looking at the big toe if there's a hallux valgus, which there is not as well. And you're also looking for any swelling or bruising anywhere at the ankle, which there doesn't seem to be. Okay? Now we're going to do AROM and PROM for the ankle. We're going to start with dorsiflexion. So I'm going to go up like this. Can you bring your toes towards you? Okay. And then you're going to say, relax. You're going to put over pressure. Any pain? Okay. And then for PROM, you would just do the same thing. Any pain? Okay. And now for plantar flexion, you ask the patient to point their toes downwards. Any pain? You ask them to relax at end range. And then you put over pressure. Any pain? And then bring it back up. And then you would just take them through the same range of motion for PROM. Any pain? Okay. Now, for inversion of the ankle, you're gonna hold it from the heel, or like this, from the heel, and you're gonna turn inwards. Any pain?
What's this?
For PROM. Can you do it yourself? Okay. Now relax, over pressure. Any pain? Okay. And now for eversion, can you point your toes to the side? Any pain? No. So you're gonna relax at end range. You're gonna put over pressure. Any pain? For PROM, you're gonna go again. Same thing. Any pain? Okay. Now we're gonna do rhizome. Okay? So we're gonna start with dorsiflexion. You're gonna bring them to a, not exactly 90, you're not gonna put them here, you're gonna put them
Resting position.
like this. And then you're gonna tell the patient, don't let me move you. Push, 1, 2, 3, 4, 5. Any pain? Okay. Plantar flexion. You're gonna get close to the joint and you're gonna tell the patient, don't let me move you. And you were measuring, you were resisting dorsiflexion here, and this way you were testing plantar flexion. Okay. For eversion and inversion, if I go like this, I'm pushing an eversion. That means I'm resisting inversion. Okay. Don't let me move you. 1, 2, 3, 4, 5. Any pain? So I was pushing that way. She was pushing this way, and then you change your hand positioning. And I'm pushing an inversion, but she's going to be resisting eversion. Okay, you ready? Don't let me move you. 1, 2, 3, 4, 5. Any pain? So now we're gonna continue with the part 2 of lower extremity. So we're back at the ankle now. And now we're gonna palpate the lateral and the medial malleoli. So you wanna start on one side. So let's start on the lateral side. So you go, you palpate. And then this big bone here is the lateral malleoli. Then you go on the medial side. And then you palpate the bone. You go down. This is the medial malleolus. Okay. So now we're gonna palpate the malleolar grooves. You find the malleolus like you did before. So the medial and then the lateral on this side. And then you just go posterior and it should be right behind. So now we're going to move on to the calcaneus, and we're palpating the tuberosity of the calcaneus, and that's where the Achilles tendon inserts on the calcaneus. It should be right here. Okay, so this is the calcaneus bone, tuberosity is right here, and the Achilles tendon would be. So the calcanei tuberosity, it's the whole thing here. It's not just the point, it's the whole tuberosity right here. So on the exam, you should say that this whole thing is the calcanei tuberosity. So sustentaculum tali is over here. This is the head of the talus, so you want to go just a little bit lower, and then again dorsiflexion eversion, and it would be right here. Okay, so medial malleolus. You feel the bump here. That's the head of the talus. You go back to the medial malleolus, you go a bit more posterior down, and then again, you should feel the sustentaculum tali pop into your fingers. Now we're gonna palpate the peroneal trochlea. So that's on the lateral aspect. So you go again, you find the lateral malleolus, you put the foot in dorsiflexion, and it should be 1 inch inferior, like around an inch below, and then you ask the patient to evert, and then back straight again. And then you should feel the peroneal tendons popping into your fingers.
Yes. Yeah.
Right here. One more time? Yeah. So the head of the talus is between the medial malleoli and the navicular bone, which is right here. So medial malleolus, head of talus, navicular bone, medial malleolus, sustentaculum tali. We're gonna do trochlea of the talus, and this one you want the leg to be passive. Okay, you're gonna come anterior and medial to the lateral malleoli, so over here. Put the foot in dorsiflexion, and then put it in plantar flexion and invert it, and you should feel that bone pop. You can even see it right here.
So then you only wait, like, I think also has
So now we're going to be palpating the medial tubercle of the talus. So you're on the medial malleolus. You're going to go at a 45-degree angle posterior.
And the foot has to be at 90
and
degrees.
inferior. Yeah, foot is at 90 degrees. You should feel a tubercle here, and then you can move it, and you'll see that it's going to move with the foot as well because it's attached to the talus. So one more time. Medial malleolus. Like this. You can even put the foot in a bit of eversion to feel it. That's the tubercle.
And where's the sustentaculum tali in comparison?
Sustentaculum tali is right here, and it pops into your fingers. This is the head of the talus, the navicular bone, medial malleoli, medial tubercle, sustentaculum tali, head of talus, navicular. Now we're going to palpate the cuneiform bones and the cuboid. So we're going to start with the medial cuneiform, and you're going to start with the base of the first metatarsal. And you need to palpate with the tip of your fingers, not with the flat part, but with the front part. And you want a firm palpation until you feel a bump and then a dip. That's going to be the first cuneiform bone, the medial one. You're going to do the same thing with the middle metatarsal, and there's a lot of tendons here, so you really have to be firm, and it would be right here. And then you would go from the third one, make sure not to mistake it for a tendon, and that would be the lateral cuneiform bone. Any pain? Okay, and now to find the cuboid bone, you would go along the fourth and the fifth metatarsals, and you go down, and you should feel a hard bone right here. Yeah, you could move it. We're not required to do it in this course, but here, just relax. It would be here. You can also move the calcanei. So now we're going to palpate the navicular bone. So we're going to follow the same path that we did to get the first cuneiform bone. You're going to follow the first metatarsal till you feel the bump right here. That's the medial cuneiform. And then you're going to go medial till you feel a bump. That is the navicular tuberosity. Now we're going to palpate the metatarsals and the phalanges. We're going to start with the phalanges. So this is the phalange of the big toe, and you feel the big bump. Then this would be the metatarsal. And then the same concept for the rest. Okay, same concept. Feel the bump, and then you're at the metatarsal. Here is the bump, and now you're at the metatarsal. And you go till you feel the cuboid bone over here. So this is the tuberosity of the fifth metatarsal. You start palpating here. This is the end of the phalange. Now you're at the metatarsal. And you're gonna feel a bump right here. That is the tuberosity of the fifth metatarsal. We're gonna palpate the plantar fascia. You're gonna passively, so as the patient to relax, you're gonna passively put the foot in dorsiflexion and extend the toes to put the plantar fascia on stretch. You're gonna palpate from the balls of the feet. You ask for any pain. Hopefully they say no. And then you should feel this cord-like structure because it fans out. You should feel this cord-like structure, and it inserts on the medial tubercle of the calcanei right here. Go say something for the YouTube video.
I don't know. I hope you guys liked it.